Welcome to this narrated PowerPoint presentation. It's titled How to Read a Chest X-ray, and this is essentially just a small online sample, if you like, of a teaching session. My name's Alan Hilliard. So here's what I'm aiming to cover in the session. As I mentioned, this is a snapshot of a teaching session, and it's about chest imaging. There's also a separate file that you can look at that is a quiz. So once you've looked at this narrated PowerPoint presentation, you can then go ahead and take the quiz that's based on it. The outcome here, what we're trying to do is by the outcome of this session is just to enable you to start to be able to recognise a range of some pathologies on chest x-rays. What you're looking at on the screen now is a chest x-ray. When we look at chest x-ray images, we look at it as if the patient is standing facing towards us. So this is the patient's right side here, and you can see that their heart is over here on the left side. When we look at chest x-rays, then what you see on the image depends on the density of the structure itself. More dense structures show up as whiter. Less dense structures show up as grey. What we can see here, we can see bone on the image as well here. So we can see the patient's ribs. Because they're quite dense, they show quite bright on the image itself. And here's another rib here. We can also see the patient's clavicles. That's part of the bones of the shoulder girdle. And they are here. Because the lungs are full of air, they're less dense than the bones, and because of that they don't show up as bright white. Because air is less dense than bone, it shows as grey on the chest x-ray images. So when we look at the patient's lungs, we can see them as being shades of grey. If you look at the lungs here, you can see that there are sort of some slight white streaks in the image, and these are sort of blood vessels within the lungs. Before we go on to consider what pathologies look like in the lungs, it's good to have a little thought about the actual anatomy as well, because that helps then to be able to suggest what part of the lungs pathologies might be in. And what we're looking at here is a picture that shows us the lobes of the lungs. So what we have the right lung divided into three lobes, what's called the upper lobe, the middle lobe, and the lower lobe. In the left lung, there's just an upper lobe and a lower lobe. So when we come to look at pathologies, having some knowledge of this anatomy helps us to be able to decide what part of the lungs that pathology might be in. What we're going to next is just consider just a few common pathologies that can affect the lungs. We're just going to focus on four areas. We're going to think a little bit about collapsed lungs. We're going to consider what's called a pneumothorax. We're going to look at lung tumours and also consider what's called a pleural effusion. So these are just four common pathologies, and we're going to look at chest x-rays and see how they appear on the images. We're going to begin by considering a collapsed lung. When the lung does collapse, the medical term for it is atelectasis, and that term refers to either a partial or full collapse of a lung. There are a number of different causes for lungs to collapse. One of the most common reasons that lungs can collapse is due to obstruction of the airways or bronchial obstruction. In the diagram here, what we have is the bronchial tree, and it shows the airways of the lungs. It shows where they divide and they get smaller and smaller. In order to cause a collapsed lung here by obstruction of the airways, it could be that something gets inhaled into the airways and cause it to become obstructed. Perhaps in children this could be a small toy that they may inhale, and that may then pass into the airways and become lodged, and that would then prevent air from passing beyond it. You could also get obstructions to airways due to infections or other pathological processes, and essentially where the airways become obstructed, the air then can't get into the lungs beyond the obstruction, and so the air sacs that would normally inflate within the lung are unable to do so, and so part of that lung then collapses. It can't become filled with air. If you think back to the beginning, where we talked about the density of structures and how the bones show up as whiter on the images, and because the lungs are filled with air, they show up as grey. When lungs collapse, part of the lung doesn't fill with air, and where the lung collapses, it becomes more dense. So it starts to show up as brighter on the image. And also now thinking about where we talked about the lobes of the lung, that will now help us to identify what part of the lung here has collapsed. What we're looking at is a collapse of the right upper lobe of the lung. So we're looking at this part here. This shows the area of the collapse. And you can see that it's not as dark as the air-filled lung that's around it. And that's because as it's collapsed, it now shows as more dense on the image. This is an example of a chest X-ray that shows a right middle lobe collapse. If you look at the little image to the right-hand side and then look at the chest X-ray on the left, you can see what's happened here is that the middle lobe of the lung has now collapsed, and part of the lung above it and part of the lung below it compresses it, so it becomes more dense on the image, and therefore again it shows as brighter on the image. So here is where we can see the density of the right middle lobe collapse on the chest X-ray image here. As a final example of a collapsed lung, what we're looking here this time is a right lower lobe collapse. So this time it's a collapse of the lower lobe of the right lung. When that happens, the collapsed lung moves towards the midline of the chest, sort of the middle of the chest. So it is quite a subtle pathology to recognise on chest X-rays. What we're looking at here is the example of the collapse is here this time. It's quite subtle, and you can just kind of see this little triangular shape where the lung has collapsed in towards the middle of the chest. It often gets described as a sail sign because sometimes you get this triangular shape at the base of the lung here. So the lower lobe collapse is often a bit more subtle and a bit more difficult to spot, but you look for this little increased area of density, usually towards the middle of the affected lung here. We're now going to go on to consider a pathology called pneumothorax. The term pneumothorax means air in the pleural cavity. This can happen really by either a tear in what's called the parietal or the visceral pleura. The pleura are the coverings of the lungs, and these help the lungs to stick to the outside of the chest cavity. When there's a tear in the pleura of the lungs, then air can get into that cavity, and so the pressure of the air can build up in that cavity. When this happens, the lung then relaxes back and kind of moves towards the middle of the chest, what's called the hilum. The hilum of the lungs is the part of the lungs that actually faces the middle of the chest. Typical causes for a pneumothorax are often due to things like stabbings, or they could be due to where patients have had trauma of the chest and where the patients obtained rib fractures. Then part of the fractured rib can puncture part of the lung. This is what a pneumothorax looks like on a chest x-ray. So what we're looking at here is this is the normal lung on this side. So if you think back, we say about the lungs being full of air, and so they show up as shades of grey. Within normal lung, you see these bright white streaks throughout the lung density, and this is the blood vessels in the lung. It shows that the lung's inflated. If we now look at the other side, this left lung here, then what we have, this is the lung that shows the pneumothorax. And what's happened is that air has got into the pleural cavity. So the air is showing as black on the image. And what's happened is that the lung has actually collapsed towards the middle of the chest here. So this is the collapsed lung here in the middle. And what we have is air in the pleural cavity outside of that lung. When you look very carefully at it, you can see that it looks darker than the normal lung. But when you look at the grey and look at it closely, you don't see any markings of blood vessels within it. It's literally just air in the pleural cavity. So the absence of the lung markings is what kind of gives that away as being a pneumothorax. And that's what you look for when you look at chest x-rays for pneumothorax. The pictures here show an example of a patient that's come into A&E because they've been stabbed. And so what we're seeing here is the patient gets sent around for an x-ray and they leave the knife in situ. You can't remove that knife from the patient until you know what areas of the lungs or the blood vessels or the heart's involved. So you couldn't just take that knife out until you've actually x-rayed the patient. And so if you're working as a radiographer in A&E, then sometimes you may find a patient gets sent around in a situation like this, and you have to take the x-ray with the patient still with a knife in situ. This chest x-ray shows another example of a pneumothorax. When we looked at the chest x-ray with the previous pneumothorax, it was very big and the lung had completely collapsed towards the middle of the chest. In this image, this side is actually the normal side of the chest. So this is the normal lung here. And you can see the blood vessels. If you follow them right towards the edges of the lungs, you can see these little light white markings all the way out to the edges of the lungs. If we now look at the affected lung, which is the lung on this side over here, if you look very carefully, you can just see a line that goes up here. And this is actually where the lung has started to collapse away from the chest wall. So when you look at this image, and you can see blood vessels within the lung here, but where the lung edge has collapsed away from the chest wall, if you look beyond that line, then you don't see any more lung markings. And that's because that is just air in the pleural cavity that's pushed the edge of that lung away from the chest wall. And so it's just air in this part here. But you can still see blood vessels in the lung where it started to collapse away. We're going to move on to consider lung tumours next. Lung tumours tend to arise from the linings of the airways within the lungs. And as such, lung tumours can occur anywhere within the lungs. They may occur within part of the lungs themselves. They may occur in the areas that you can't see towards the middle of the lungs. so the inner part of the lungs here. So essentially tumours can appear everywhere, but approximately half of them are found what you call towards the edges of the lungs, or certainly within the lung fields. They tend to show as dense round masses, and what we can do is we can see that here, this very, very clear round area shows as being more dense than the air in the lung tissue, and so it shows as much brighter than the air in the lungs that surrounds it. So this very smooth, very rounded area shows us where the lung tumour is here. On the previous image, we looked at a tumour within the lung that had arisen from the lining of the airways. So the primary tumour, if you like, was situated within the lungs. You can also get spread of tumours from other organs and other parts of the body. And the lungs are probably the most common organ for secondary deposits of cancers to arise. Where that happens, they get called lung metastases or secondary tumour deposits. Tumours that can commonly spread to the lungs are tumours of breast, kidney, the testes, the gastrointestinal tract, also the thyroid, and also tumours of bone. So these primary tumours can commonly spread to lungs, often through a blood route. When you look at an image that shows these secondary deposits or these lung metastases, you often get multiple dense opacities within the chest. So there's one here, there's multiple deposits throughout the chest. Where you get very rounded metastatic deposits, they often get described as being cannonball metastases because they're very rounded and appear like, if you like, cannonball shapes. So within the lung here, we can see multiple dense deposits. And this is an example of what you see when you have what's called lung metastases, these secondary tumour deposits within the lungs. The final pathology we're going to consider here is a pathology called pleural effusion. What a pleural effusion is, it's a collection of fluid within the pleural space. So where you have the lining of the lungs and the lining that lines the chest cavity, the space between them becomes filled with fluid. And it can be due to a whole range of different causes. It can be due to patients who have heart failure. It can be due to infections, infarctions of the lungs, malignancies, or it can also be due to trauma or surgery. So this is an example then of an image here that shows pleural effusion. What we're seeing is a normal lung on this side here. But on this side, this shows an area of lung tissue, and all of this area below is fluid. Because fluid is much more dense than air, the fluid shows as white on the X-ray. So the fluid that's within the chest cavity, often it can move up from the bases of the lungs, and the fluid can move up the chest wall towards, starting usually at the bottom and moving up towards the top. One typical characteristic of a pleural effusion is that it tends to have almost like a little triangular shape at the outside edge, almost like a leading edge of fluid as it moves up the chest wall. The technical word for it is a meniscus. So it's essentially this triangular shape on the outer edge of the chest wall where the fluid starts to move up the chest wall. This is the end of the short narrated PowerPoint presentation now. We've considered just a few different types of pathologies and looked at their appearances on a chest X-ray. What you can do next is go to the quiz file that has the same name as this but has the title quiz in there as well, and you can work your way through that to test your learning. Good luck with that.